So good morning, everybody. We're going to get started. So my name is Doug Opel, and I have the pleasure of moderating today's Ethics Grand Rounds and introducing our two speakers. But before I do that, I wanted to take a few minutes to remind everyone about the format of this Ethics Grand Rounds. So this is meant to be a case-based consideration of an ethical issue in pediatrics, and the case presented today and in past Grand Rounds are really inspired by actual events, but are generally modified and intended as a starting point to consider the issues raised. The case today will be presented by a children's clinician, who today will be Dr. Doug Diekema, who I'll introduce shortly. And there will be an opportunity to ask clarifying questions after the case is presented before we move on to our invited speaker, who for today is Dr. Dina Davis, and I will also introduce her shortly. After the commentary, we want to stimulate discussion amongst you all and invite you to make the way to the aisles where there are microphones situated if you would like to ask a question or have comments. Lastly, I wanted to mention that Ethics Grand Rounds is sponsored by the Truman Katz Center for Pediatric Bioethics and is supported by a fund established by Jeff Sconyers and Deborah Gottfried, who's here today. Ethics Grand Rounds occurs quarterly, and our next Grand Rounds is in October and will be on the topic of the intersection between bioethics and palliative care. Dr. Bob McCauley, who's the Cambia Health Foundation Endowed Chair in Pediatric Palliative Care at Oregon Health Sciences University in Portland, will be our invited speaker. So now into introductions. Our case presenter and first speaker today is Dr. Doug Diekema. Many of you know him. He's a professor here in the Department of Pediatrics and attending emergency room physician at Children's here. He completed medical school at the University of North Carolina, residency at University of Wisconsin, and fellowship here at UW. He's been on faculty for over 25 years, serving in crucial roles in the Ethics Center, the IRB, and graduate medical education. So, Doug, thank you for doing this. I'm going to also introduce Dr. Dina Davis as well. Dr. Davis is the Presidential Endowed Chair in Health and professor in the Department of Religion Studies at Lehigh University. She received her PhD in Religious Studies from the University of Iowa and JD from the University of Virginia. Her research interests are primarily in bioethics, and she's published widely on a diverse set of issues with ethical import, ranging from genital alteration of female minors to pelvic exams performed on anesthetized patients to reproductive technology and genetics. So we're delighted to have Dr. Davis here today. So without further delay, Doug, why don't you get us started?
Good morning. So we're going to talk about, as Doug said, sort of an amalgam of several cases that have come up for us. And in this particular situation, a father brings his 16-year-old daughter to the emergency department with concerns that his 18-year-old nephew has had sex with her. His concern arises from the fact that he caught the two of them together and they were acting odd, fully clothed but acting odd, and he demands a virginity check to determine whether she's had sex. So the scan team is consulted, and it's clear from further discussion with the father that his daughter's possible loss of her virginity will create substantial stress and strife for her and the family. And the father at one point makes the statement, if my daughter has lost her virginity, I'll kill my nephew. The clinical approach to this issue by the scan team, however, is that they don't do virginity checks in children, and that's based on the fact that there's a lack of an evidence base to suggest that physical exam findings, if present, would suggest that a child has had sexual intercourse or the opposite, has not. So in general, these are discouraged. So the scan consultant instead asked for permission from the daughter to perform a general GU exam. She agrees to that. The parent leaves the room. And the scan consultant doesn't see any physical exam findings that are suggestive of assault. And so when finished with the exam, she brings the father back into the room, and the child appears, and tells the dad that the child appears healthy and that no further workup is necessary. The father, however, finds that response unacceptable and says, I didn't ask you to tell me that my daughter's healthy. I asked you whether she is a virgin. So is she? And he restates the importance of his daughter's virginity to preserving her purity and future marriage interests. The scan consultant decides to tell the father, given sort of what she's heard, that his daughter is a virgin, judging that the benefits to doing so will outweigh the potential drawbacks. And so the questions that we are posing to Dr. Davis are the following. How should a provider respond to requests for virginity checks? And is it appropriate to tell the father that his daughter's a virgin, even if we have no way of knowing whether or not she has had sexual intercourse?
Any clarifying questions for Dr. Deekema before we move on to Dr. Davis? There's a lot to pack in a few slides.
Did the daughter seem upset? Like, if what had happened, what did it seem to have been consensual or?
She seemed unconcerned and fairly passive.
Good morning. Thank you so much for inviting me. We've tweaked this case kind of back and forth for a while, tweaking the daughter's age, among other things. And we had a long phone call among some of us a while back on this case. It's a really strange case, and it took me a while to figure out why. And in part, I have to thank my students in my bioethics class. I shared this case with them, partially because I thought, what am I going to do this morning? Oh, okay, I've got this case. And I'll flatter them by saying, hey, I've got to talk about this. And I was struck by the fact that they really homed right in on the fact that virginity check does not exist, right? That there is, as Doug said, no evidence that one can actually tell if a woman has had sex or not by doing this. And they said, well, what if the father had shown up wanting a voodoo ceremony or some other thing that is simply not a medical thing? What would we say to that? So what we've got here is a family with no prior relationship to any of the practitioners. They show up with a young woman who has no medical condition. I don't take having had sex to be a medical condition. And they're asking for a medical procedure, a virginity check, which in fact does not exist. So the question of whether or not to lie to the father, although I'll get there, is, I think, kind of the least of our worries. So what do we know for sure? What touchstones do we have here? Well, clearly, our sole concern should be for the young woman. Our concern for the father and that shadowy family in the background is, I think, only there as it relates to our primary concern for the girl. So the relationship between pediatricians and patients is fundamentally different from that of physicians and adult patients in many ways, but perhaps most obviously because it is a triangular relationship, the physician, the parent, and the patient. And for the most part, the child does not arrive voluntarily on its own volition, but is brought by the parent. It's the parents who choose pediatricians, arrange appointments, and pay the bills. But nonetheless, the patient is the child. And it's to that child that the pediatrician owes her primary loyalty, her fiduciary duty. And what matters then is what is in the best interests of the child. And that goal may be elusive. A physician cannot, for example, vaccinate a child over parental objections, though I know a lot of doctors who wish they could. But it remains the primary goal. So to quote from the 2016 revised AAP statement on informed consent in decision-making in pediatric practice, quote, in pediatrics, the duties to protect and promote health-related interests of the child and adolescent by the physician are also grounded in the fiduciary relationship, that is, to act in the best interest of the patient and subordinating one's own interests. A fiduciary relationship between the physician and patient, but these duties may conflict with the patient's or the parent's wishes and set up tensions either within the family or between the family and the physician, close quote. Well, I think we can all say, yep, we've been there. So in this case, the parental goal to ascertain if the young woman is a virgin is not necessarily our goal, even if that goal were attainable. Okay, so what are our concerns about this young woman who has, arrived kind of on our doorstep? Well, first, is she here voluntarily? And if not, is there any mandate to talk with her, much less examine her? Note that in Washington state, a 14-year-old may be prescribed contraceptive, treated for STDs, or even procure an abortion without the knowledge or consent of her parents, but the age of consent to sexual activity is 16. So as a 16-year-old, she in some ways is kind of functioning, legally anyway, the way an adult would. So if she's indeed sexually active with the nephew, or about to become so, does she have access to good information about contraceptives, STDs, and safe sex? If she has had some form of sexual activity with her cousin, even if it is not intercourse, is it consensual? And finally, what are the consequences to her if the family is not reassured about her purity? What are the professional concerns then from the perspective of a healthcare provider? Well, if virginity checks are not in fact a thing, as my students would say, why should we go along with a request for something that has no medical integrity? What if the parents showed up and wanted a voodoo ceremony performed? What if they wanted to know for sure if their adolescent daughter would ever get breast cancer? In those cases, we would want to educate them about what is and is not medically possible. This might seem like an odd parallel, but pediatricians are sometimes pressured by parents to give antibiotics for viruses, and the correct response is neither to give in nor to give a pretend antibiotic, but rather to explain why that is not medically appropriate. It's worth reminding ourselves of the ideal physician-parent-adolescent office visit where sexual issues are in play. The 2017 AAP policy statement on sexual and reproductive health care services in the pediatric setting assumes the context of an ongoing relationship between doctor and family. Physicians are urged to discuss privacy and confidentiality with parents and patients when the patients are about 11 years old, setting the stage for a new set of practices in which time is set aside at each visit for the young person to be alone with the provider. Pediatricians should discuss sexuality, abstinence, contraceptives, sexual orientation, etc., with their adolescent patients. Physical exams are conducted with a chaperone in the room, but not necessarily the parent. This is clearly very different from the situation confronting us in this case. So, what to do? It seems to me that the first goal is to get the young woman alone with one or more, preferably female, healthcare providers, but without her father. The fact that her father has come alone with his daughter without her mother or sister can work in our favor. He hardly expects to be in the room during a pelvic exam. And it seems that, in fact, that did happen. The young woman was detached from her father. That goal accomplished, the next step is to explain to her that we will not examine her or touch her in any way without her permission. We should also explain to her that even if she were to submit to an exam, there is in fact no such thing as a virginity test, and we cannot determine by examining her whether or not she has had penetrative genital sex. We should also assure her that anything she says to us within the boundaries of the law is confidential, and we will not share it with her father or anyone else without her permission. I think the next step would be to ask her why she and her father are here. She may have a very different story to tell than the one that he came in with. It could be, in fact, that they were acting oddly because they were smoking pot or discussing, I don't know, who knows what, right? It wasn't necessarily physical or sexual at all. In any case, assuming that there's some sexual element here, we should try to ascertain the following things at the very least. Is she sexually active with her cousin or anyone else? Is the sex consensual? If so, what kind of sex is she having? This could have been kissing, for example. And is she interested in information about safe sex and contraceptives and so on? If we can't give her printed information to take home because of her father, we can suggest books available in her school library or reliable websites. My understanding is, and I could be wrong about this, that a pelvic exam for an adolescent girl who is not sexually active is not standard medical practice. So there's no reason to offer it over and above the impossibility of using it as a virginity check. So if she says she's not sexually active, I would give her whatever information she would like and confidently tell her father that she remains a virgin because she told me so. Bracketing for the moment what to do if the father demands to know how you know that, and I'll get back to that. If she is sexually active, you could offer an exam to check for STDs and general sexual health, reminding her, again, that there is no such thing as a virginity check, and that in any case you will not tell her father anything without her permission. If she refuses, that has to be respected. If she agrees, then we are back to the case. You do an exam, she's healthy, there's no sign of assault, and you tell the father that his daughter is healthy. There are a number of places in this scenario where one might have to decide whether or not to lie. If the young woman is not sexually active, is it permissible to lie and tell the father that, 1, you examine the girl, and 2, there is such a thing as a virginity check, which he believes, and 3, that she's a virgin? If she is sexually active and refuses an exam, should you cover for her by saying you did examine her and she's a virgin? If she's sexually active and you did examine her with her permission, should you tell the father that she's a virgin even though no test for such a question actually exists? First, it seems that any lying should be done with the knowledge of the woman. We don't want to risk confusing her. For example, saying she's definitely a virgin when she knows she's had sex, and maybe now she's thinking, wait a minute, I thought what we did this afternoon was sex, but now the doc says I'm a virgin, so that's cool. I guess, we can go on doing that without risk of pregnancy. I mean, I think we think that we know what sex means, but, lots of high school students, for example, do not believe oral sex is sex. I mean, I don't care, right? It's purely a question of definition, but, we're not necessarily all on the same page when we use the word sex. Okay, it's always preferable not to lie, but if I found myself trapped in one of these scenarios, I think I would lie without a great deal of hand-wringing. And I'm noting here, I don't believe physicians should ever lie to their patients. But in this case, the father is not the patient, the young woman is. So one is either very directly or perhaps by inference colluding with this young woman to lie to her father, which does feel a little uncomfortable. There are good consequentialist reasons to tell this lie. The father has stressed how important the young woman's purity is to the family. He said that he will kill the nephew. I mean, presumably he won't really do that, but there's going to be a great deal of disruption. If she did find out, if she did have sex and the father finds out, there'll probably be negative consequences for her, the cousin, and the entire family. Even if she hasn't had sex, if you are truthful and say, hey, there's no such thing as a virginity check, then the suspicion is not laid to rest, and that will also presumably have negative consequences. On the other side of the consequentialist ledger, I don't see great negative consequences of lying. There is no ongoing relationship with this family that would be disrupted if the lie is found out. Yes, the young woman discovers that doctors sometimes lie, but more important, she learns that at least this doctor is on her side. Ironically, in this case, to lie is to be trustworthy. Of course, one negative consequence is the father is affirmed in his mistaken belief that there is such a thing as a virginity check, and he, or perhaps others in the community, might keep dragging their daughters to the hospital for this purpose. So, that would definitely be a negative consequence. By the way, I might feel differently if the young woman were acting more independently. If she came to you of her own accord, a stranger, and said, "Hey, I need help. My father caught me with my cousin, and now we're in deep trouble, and I need you to lie for me," I would probably demur and try to find another way out with her. But as the case is written, the girl is kind of being dragged to the hospital by her father. She's trapped in this difficult situation, and she needs an ally, and that ally is you. What about other non-consequentialist arguments against lying? Isn't lying almost always wrong? Doesn't it show lack of respect for the person to whom you are telling the lie? Maybe, but I would argue that we only owe the truth to persons who are entitled to it. What if someone asked me if I'd ever had an abortion or if I'd engaged in sex outside of marriage? Obviously, the best answer is a robust none of your business. But what if one is forced to answer? If a person has no right to that knowledge, is not entitled to it, then I would argue that the lie is not necessarily unethical. In a book entitled Ethics, the Lutheran theologian Dietrich Bonhoeffer makes a similar point. He takes up the example of a child who is asked in front of his classmates by his teacher if his father often comes home drunk. And in fact, the child's father often does come home drunk, but in answer to the teacher, the child denies that that description is correct. According to Bonhoeffer, the child rightly lies in answer to a question that should never have been asked. Bonhoeffer explains that the family has its own secret and must preserve it, which the teacher has failed to respect. Ideally, the child would have the ability to answer the teacher respectfully while preserving his family's honor and his right not to be the object of pity and scorn by his classmates. But that is more to expect from a child than should be expected, to quote ethicist Stanley Hauerwas. Bonhoeffer does not deny that, quote, the child's answer can indeed be called a lie, yet this lie contains more truth, that is to say, it is more in accordance with reality than would have been the case if the child had betrayed his father's weakness in front of the class. According to the measure of his knowledge, the child acted correctly. The blame for the lie falls back entirely upon the teacher, end of quote. So much of the difficulties of this case lies in the fact that there is no prior relationship between this young woman and the healthcare providers. Like so many bioethical dilemmas, this is at least in part a failure of communication, although in this case there was no opportunity for prior communication. We can often avoid some of these difficult dilemmas if we have longer-term relationships with families and we all understand some of the ground rules. Perhaps a pediatrician has a policy of seeing all patients over 14 in the examining room without their parents and doesn't treat families who will not accept this. Maybe the doctor reminds parents periodically of the laws in her state that allow adolescents confidentiality around certain sexual issues. I expect the highest level of confidentiality from my physician, but I also understand she's required by law to report gunshot wounds and dog bites, and that there are other pre-existing limitations on what I can tell her and what she can keep to herself. Finally, I want to open up kind of a different can of worms here, which is, what if, I mean, my concern about this case in part is that the young woman may have had some form of consensual sex, not necessarily intercourse, some form of sex, not necessarily intercourse, that is not consensual. That's another concern that I think we have to be worried about here. She's 16, the young man is 18. That's not a huge difference in age. But on the other hand, in what sounds like a fairly traditional and perhaps somewhat authoritarian family structure, this cousin may have access to her and other people in the family that simply a boyfriend, some boy she met at school might not, right? He may be a privileged person in that way. And it's not impossible that even at the level of kissing or whatever, that he is taking advantage of that privileged position. And because he's her cousin and because the father has claimed that he will kill him, or at least something pretty bad will happen if, in fact, he finds out, one could imagine a situation in which this young woman is being sexually harassed or assaulted by her cousin and feels powerless to say anything about it. And we'd need to know more about the family to know, if in fact they did have intercourse and it was not consensual, and she told her father, what would that mean for her situation in the family? Would she still be considered to have somehow lost her purity, and so on and so forth? So if that's the case, she might have a host of really good reasons to keep her mouth shut about it. Good reasons to her. But that's something that we would, as healthcare providers, have a huge concern about. And it would also mean that we would be required reporters. And then that's something that we would have to tell her beforehand, right? That, we really want you to be, frank with us, because that's the best way we can help you. But on the other hand, we have to tell you that there are certain things that we cannot keep private if you tell us. This happens to me on college campus, not as infrequently as I would wish, where, some student comes to tell me something and they say, well, but I don't want to report it. And I say, well, it's too late because I'm a required reporter. So it's better to lay that out in the first place. But that, it seems to me, is a much more difficult ethical problem because you want to help her and you're not necessarily going to be able to do that. So those are my comments on this very strange and complicated case. And thank you.
Hi, Dina. So,
Hey, Ben.
thank you for your comments. Actually, my first, I guess I have a question, but I first need to get some clarity. I want to make sure I understood what your position is, which is that you would ascertain whether she has been sexually active, but regardless of what the answer is, with her permission, your intention would be to tell the father that you did do a virginity check and she is a virgin. Is that correct?
Yeah,
Okay.
assuming that that's what she wants.
Right.
And that's the only way to, which I understand from the case, is the only way to placate him.
Okay. So I guess that's the question I have. Because it seems to me, I think you, first of all, it's very clear. The dilemma between, as you described, the fact that a virginity check doesn't, quote, exist in the way as he's describing it, the choice is either not only lying about her status of what the result is, but even about the existence of that exam. And, so I'm just really kind of, I guess
Yeah.
I'm still digesting that. But
Right. But it seems to me, you cannot, in one and the same time say, your daughter's a virgin and I have no way of ascertaining
Right,
that, right?
right.
I mean,
So, and you did point out that, of course, one of the implications of this will be how this might affect other people in the community later on as they become aware of this. But I guess that's also maybe even just a question is, as you think about this happening repeatedly in the ER with multiple patients, would that change how your perspective on this?
yes, I mean, as I said, that seems to me the clear negative consequence, right? That he goes home happy and he says, we've been very, how shall I say this? This case has been presented in a very deracinated way, in the sense that we really don't know who these people are, right? But in our phone conversation, I kind of got the feeling that they were from a particular ethnic community, that perhaps a particular religious community or whatever. So if they are, in fact, part of a sort of tight-knit community, one could imagine that he proudly goes home and reassures all his relatives that all is well, because Dr. Hoo-ha at the Children's Hospital said that my daughter's a virgin, and they think, well, this is great. There's this thing we can do, and then it becomes a practice. And that would obviously be a negative consequence, to be weighed against doing what I think is the right thing for this young woman.
Hi, that was a really great breakdown of a really complex case. You had mentioned that you had gone through a bunch of different ages to kind of think through the case, and so I wanted to know what you would say if you had presented a girl who was 13.
Well, then, yeah, we went through this. We had a couple of iterations of this. To my mind, that's entirely different. A 13-year-old cannot consent, and she therefore, if sex happened, and which is a big if, right? But if it happened, then she's the victim of a crime. You're a required reporter. You don't have to report that a 16-year-old had sex because she can consent to do that, right? But you absolutely have to report that a 13-year-old had sex. And that's an entirely different thing. A 16-year-old who may have had sex, I'm kind of thinking, okay, this is, her choice, and she's legally able to make that choice, and I'm going to be kind of her ally in protecting, her privacy against her family. But a 13-year-old who's had sex, even though it might feel consensual to her, legally we can't understand that as consensual. And, at that point, it's just an entirely different case. And the status of the nephew or the cousin also changes, right? At one point, I don't remember anymore, at one point he still might have been 18 and she was 13. And that's, so he's now allegedly committed a crime. Even if he's 14, Washington State does not have a Romeo and Juliet exception, which some states do. So, he's still possibly a criminal in a juvenile sense. So that's just, to my mind, a completely different case. I guess just to finish that, one thing would be a 16-year-old who says to me, it's none of your business, Doc, if I've had sex or not. Okay, that's fine. A 13-year-old who says that's an entirely different situation.
So I've had this more times than I can count, this exact scenario.
Wow.
Over the years. I'm in adolescent medicine, so this is a common occurrence. And it usually is the first time you meet somebody because that's why they're coming. But I've never, and it's always usually because of either religious, cultural, different, there's a lot of different reasons people want to know their daughter. I never have had it for a male. Their daughter is a virgin.
Mm-hmm.
But I've never gone through and made them think that there was actually a test. I actually spend a lot more time with the family. And they come back. And, the thing that I've would worry about is one, that could be her boyfriend, and while it's unacceptable to the parents, that could be her romantic partner, and two, it could be somebody else could be, abusing her, and so really trying to in the ER, it would be nice for that person to be referred on to. I mean, it's an easy way to refer them on to someone else who might be considered an expert, so we have an expert that can manage this so that the other parts of that are taken care of, because, in that scenario, there could be a lot of things that are not revealed by either that could be very important, so.
You have not found that explaining the virginity checks don't exist has stopped people from wanting them?
No.
No.
But if you actually said that there was a virginity check, I can
You think it would
guarantee
get worse.
I would have 100 more people in my office.
That is the problem, right.
and then you're in this whole terrible swirl. So,
Right.
I've always gone on the side of just be honest with what the limitations of medicine are, and that there's a much better way of working with the daughter and seeing what's going on than looking for that.
I actually have two questions. One, I was really interested when you said if the child, the 16-year-old youth, had come to us, or in that visit, in the confidential section of the interaction, had said, I am having sex and I need you to help me tell my dad I'm not. And it's interesting that you felt like that was a different scenario and that you would be less likely to tell the father that they were a virgin.
Let me answer that before your second question. That's not quite what I meant to say. I guess I'm seeing this case as one where, from the perspective of the clinician, the action begins with the father taking a daughter, presumably is somewhat reluctant or passive, but anyway, the moving figure here, the moving agent is the father, right? And I'm saying I want to be the ally of the daughter. If the daughter had been the moving agent, she'd been having an argument with her father, who had found her with her cousin, and, she said, and she drags him, she shows up at the hospital and says, hey, I've had sex and I need you to tell my father I didn't. That to me would feel different.
Yeah, I think it's interesting. I mean, I find that a lot of youth have a lot of agency. I think it's a little challenging to perpetuate that the father is the driving agency in this. Oftentimes parents have one perspective and you're like, okay, I'm here for a sports physical, and then they step out of the room and there's a whole other agenda. So I do think a lot of youth have some agency. That I think that this dynamic is also challenging. My second question is, what if it was a boy? And I feel, I don't know. I don't know if we'd even have a grand rounds on a boy. I feel like there is a little paternalism happening in this language, that we're assuming the girl doesn't have agency, that because she's a girl that there's more risk to her purity or the ramifications afterwards. I'm just curious about whether you all explore that in the
I think, we'd have to change it a little, but it could be homosexual sex, for example, or, I don't know, something else. But I was actually trying not to be paternalistic. I was trying to be the ally of this girl, but I was also, and maybe this harks back to the phone conversation that we had about this case, I was also trying to be realistic about this family, which I was given to understand was one in which the young woman, at least outwardly, would be pretty passive. If she just stood her ground right there in the emergency department and said, I'm not going any further, I don't want to talk to you, I would support that. But she didn't do that, right? So I don't see it as acting paternalistically.
I just wonder about the leap from ethnic, religious to paternalism. It might be there, right? Like, we're assuming this Muslim girl does not have agency, but perhaps she does, and we're making that leap. And I'm enjoying this conversation, by the way. I'm not trying to challenge you. It's just really interesting. I'm just thinking about all these connections.
No,
and whether,
thank you.
Where our
I'm
biases
enjoying
are
it too.
coming
But
in.
I had thought of, it's interesting what you said, because I had thought of my suggestions about what to do as kind of giving her agency, is saying, look, first of all, I'm going to talk to you privately without your father. Secondly, kind of tell me, what you want me to do here, right? Including possibly lying to your father. So I saw myself as giving her a lot of agency, in going back to what I said earlier, in part because she's 16. But I do think, statistically speaking, girls are more likely to be sexually assaulted than boys, right? So it's not unreasonable to be more concerned about that than, someone told me an 18-year-old boy was being sexually assaulted by his 16-year-old girl cousin. Maybe, but more likely the opposite way. So I don't think it's an unreasonable concern. I know lots of college students who you think, have agency a lot more than a 16-year-old living at home, and they end up sexually assaulted on campus. So, I think I'm trying to be on her side and be realistic at the same time. If I'm being paternalistic, it's to the father, right? Right, because, if you lie to somebody in ways, well, it's not really paternalism. That's too cute. I won't go there.
Thanks.
But if anyone's agency here is being constrained, it's the father's because he's being told an untruth.
So I appreciate the ethical questions and conversation that we're having. I want to be careful about what the law provides in Washington. I'm not aware, actually, that there is a specific age of consent statute in Washington. There is a gradation in the criminal code based on age for sexual encounters when the age differential is enough, and it's graduated at age 13, age 14,
Right.
age 15. Generally speaking, in Washington, most people would consider that when a person reaches the age of choosing to engage in sex, that they have reproductive freedom, and so they have the ability to consent. It's not really clear that that's the law. There's a court case that provides for that, but that's how a lot of people have interpreted it. So it's pretty murky, actually, what it means to consent, who has the ability to do that. We went through a process here some years ago of looking at what should be a reportable event from a child abuse and neglect standpoint. There are 13-year-olds who may have an encounter. So let me back up and say providers have an obligation to report whenever they have reason to suspect that abuse or neglect has occurred. So you don't have to have certainty. You have to report
Right.
whenever you have reason to suspect. But the question of what abuse or neglect is a complicated one. And if a 13-year-old engages in some exploratory behavior with another 13-year-old, that's not necessarily a crime.
Right.
It's not necessarily abuse, and it's certainly not necessarily reportable. It may be, but you have to take the circumstances into account. What we tried to figure out was if it's a crime, so if the age differential is sufficient, then it necessarily must be abuse, because we've defined that that's outside the bounds of what's acceptable. But I think it's 16, when you get to 16, there's no longer the age differential issue.
Right.
So it's more the trusted relationship, whether it's a parent or a teacher or a coach
Right.
or somebody like
Right.
that. But up until then, there is this age differential where we take into account how different is the age between one actor and the other. And if one actor is sufficiently older than the other, then that does constitute potentially a crime.
Thank you. That's very helpful. So just so that I understand it, we're agreed that a 16-year-old girl can have consensual sex in the legal sense with, say, an 18-year-old boy.
A 16-year-old girl having sex with an 18-year-old boy would not constitute a crime under Washington law.
Right. Okay. But
I don't know whether that constitutes consent or not, but it doesn't constitute a crime.
right. I mean, it constitutes a crime if he forces himself on her, and therefore it's important to say that she can give consent. Right. Okay. 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 We'll leave it there. Yeah.
So thanks for that great commentary. I want to return to this question of lying. Because when I first heard about these sort of spate of cases, the thing that really stuck with me is that I just really felt uncomfortable with lying to this father. And in some ways, this harkens back to Dr. Leslie Walker Harding's question in that, or approach really, in that why aren't we right up front saying, Dad, this is not possible? And really the tension created then is, but I still want to talk to your daughter alone. So that to me seems really the difficulty here, but it's almost sort of my sort of intuition as well to just say, look, I can't do this, so I'm not even going to give you the impression and be implicit in any way. I'm going to say explicitly, I can't do this, but I'm glad you're here. And I do want to talk to your daughter. Will you let me talk to her alone? I mean, maybe not even ask for permission to do that, but, you know, and make it so that you can have time alone to, as you appropriately said, understand from the daughter what's going on. So
No, I do think that's the other very reasonable approach, but then that would have to be hospital policy, right? You know, we don't give antibiotics for colds, and we don't do voodoo, and, you know, we don't do so-called virginity checks because they don't exist.
Do you need a hospital policy for that? I mean,
Yeah.
I mean, in other words, what I mean by that, in the absence of a policy,
Well,
it still seems like it would be a reasonable approach.
well,
for
it gets less reasonable, right? Because then, you know, the person says, gee, Dr. Opal doesn't do this. He says, I'm not doing it because she can't do it, right? As a matter of evidence, doesn't exist.
Right.
But 2 weeks ago, my friend took his daughter here, and Dr. Jones did it and said that she was a virgin. I mean, it seems to me very hard, you know, to avoid the doctor. There are probably more parallels here to antibiotics than I was thinking of at the beginning. But, I mean, you know, if you have doctor shopping, right, or if you have a very inconsistent face to the public, then I think it's much harder to do what Doug wanted to do, right? Right. I mean, if you say, look, I'm not doing this because it doesn't exist, then, you know, I mean, one question might be, who's going to pay for, what's your code here for doing something that doesn't exist?
I guess coming off of that doctor's comment, I guess my conundrum with saying something like that is that what if, which you had pointed out is statistically more possible, that girl had been sexually assaulted, and Dad was bringing her in for a virginity check because of that, and maybe we aren't able to elicit that kind of history from that. I mean, thinking about like standing up in a court of law saying like Dad says, well, the doctor says she is a virgin, or, you know, reducing the agency of that patient by, you know, negating anything that she's said to the family.
Can you, so this is the second time that someone has said this, and I'm not clear. How is it in some way reducing the agency of the young woman?
By negating the things that she may have reported to the father. Like, maybe we aren't able to elicit, like, what else has been going on. Like, I think it was Dr. Walker had said. Maybe Dad is more fixated on a boy or girl or whoever is involved with that person. But there's also, like, abuse going on, which, you know, that's really worrisome because, you know, anything that the daughter may say, we have power as physicians. I just worry that, you know, she won't be believed, and it's
well, no,
already.
if she tells you that she's being abused, then I think we're
Yeah.
in a different ballpark.
Yeah.
For one thing, you really don't have a choice anymore, right?
Mm-hmm.
Right?
Yeah.
You know, in a more perfect world, that's something she would have known before she came in, but that's probably unlikely, right?
Yeah.
So once she told you that, your choices are very constrained. And then I don't think, then the exam takes on a very different color, right? If
Yeah.
she agrees to it. And I think absolutely you have to say that, you have to say the truth.
I guess that I feel like I would hope that I would be able to elicit that kind of history, but I don't necessarily know if I would be able to. So if there's things that are left unsaid that we can't report, I worry that there's other things, like Dr. Wachter had said, going on in the background that we're not aware of, and we are stepping into that. So
Okay, so
that's
you're-
my concern.
So your concern is that maybe there's some kind of coercion going on here. We don't know what, between the cousin and the young woman. And even though she didn't come here of her own volition, it's an opportunity for her to express that to you. And you're a little afraid that if you move too quickly to, that's okay, we'll tell your father nothing happened, that you may be shutting down some opportunity for her to, you may be moving too quickly to tie it up in a neat package.
Yeah.
Yeah.
And we're limited by time, by
Right.
nature in medicine.
Right, yeah.
Yeah.
Mhm.
So that's just a thought.
Thank you for that.
Thanks.
So we're talking about the preservation of this girl's agency and the preservation of peace within her family and all of that. What happens when, as young people do, people post on social media all about the wonderful doctor who was able to affirm this girl's virginity, and somebody in the press getting a hold of that and the reputation for the hospital being damaged and things like that?
So that's a great question that I hadn't thought of, not being much of a social media person myself for reasons that may be obvious. But no, that's a great question, and it's kind of the flip of the earlier. So it goes back to the consequentialist argument, right? So one concern is that the father will go back and happily announce to his large extended family that virginity checks exist, and this great doctor will tell you if your daughter's a virgin, and suddenly, 100 people are at your door, right?
Right.
And you're sort of thinking of another, the sort of flip of that still is a consequentialist argument. What if the young girl starts saying, hey, you can have sex, and if your father drags you to the hospital, this doctor will cover for you.
Right.
And
then that gets into the media and things like that, and suddenly
Oh,
Seattle
well.
Children's does virginity checks. Like, that's
Right, that's
not
reminiscent of something a long time ago, isn't it? Yeah, okay, I see that as a problem. It may be that from a consequentialist standpoint, I'll have to back off on that. I'm not sure, really have to think about this more. I'm not sure it's the worst thing in the world if we bracket out the media, if young women feel that, it's a little hard for me to imagine in this culture, whatever we're imagining it to be, that young women are, dragging their fathers to the emergency department. Hey, this doc is going to tell you I'm a virgin. But I'm not sure it bothers me terribly if young women know that this is a place where doctors will be their allies, and will, and if they do end up here, that it's a place where they'll be talked to privately and offered useful information. That would not, I think, bother me at all. Of course, you're right about the media. They'll get it, halfway wrong. And yes, that would be a problem that I had not thought of. So thank you for bringing that up.
I guess I have to join a number of other folks who've expressed concern about not being able to tell the truth in that setting. And I certainly understand the concern about telling the father something that would have him go off and actually fulfill his promise to kill the cousin. My question is, if you took advantage of the opportunity to say, we did an exam, she's healthy, but there is no such test as a virginity check and so forth, how, knowing the case yourself, as I don't, how do you think the father would have taken that? How would it have unfolded afterwards if you had simply said there's no such thing as a virginity check?
Thank you. I don't really know much more about this case than you do, really. I'm assuming it is a case. I mean, if the father were to say, oh, that's interesting, thanks a lot, goodbye, it's not really much of a case, right? It's then, of course, the obvious thing to do. So I assume that he would not accept it in the interest of a more sharp-edged dilemma. Thank you.